Welcome to Care Management webinar number 3. Today we're going to be talking about working with your client to make a plan. My name is Belle. I hope you've enjoyed our webinar series so far, and I hope you're trying out some of our resources, and I hope that they're helping you. Just to review, we've been talking about collaborative care model, which means simply we have lots of providers providing care for one individual. We're addressing an immediate problem, but we're also strengthening the recovery environment for our clients who are suffering from depression. So we're coordinating, we're educating, and we're supporting clients so that they become care managers themselves for their own care. You might be working for an agency that provides care. You might be not working for an agency that provides care, but you have an alliance with someone else who does that. You might be a nurse, you might be a social worker, you might be a community layperson that's been through some training. Either way, you are the glue oftentimes that holds things together. So we've been talking about some resources that are on our CPIC website. We've talked about phoning, we've talked about getting to know the client, we've talked about the PHQ-9, we've talked about the vital sign worksheet where we're keeping track and identifying trends. So today we're going to talk about making a plan. We're going to talk about a treatment plan, and we're going to talk about a wellness plan. First, let's talk about my personal treatment plan. This is a conversation that can take place after your client's met with their provider. You've done everything you can to facilitate that so that the client is engaging in that service. They've had a conversation. They've made a decision, oftentimes based on what you let them know in the Getting to Know You worksheet, and they've made a decision. Maybe they're going to try medication, maybe they're going to try psychotherapy, maybe they're going to just wait and see. Who knows? You're going to get that information and get clear understanding. Did you hear what they said? Do you agree? Okay, if there's confusion, you can help the client get back to the provider. Did you say we were going to start medications or not? Or maybe, oftentimes, clients will say they understand when they're talking to the provider because they don't want to say for the second or third time that they don't understand. So they'll just agree. Okay, so now you've figured it out that they really don't understand. So you can help them to go back to the provider and get a clear understanding and then have it written down. This is my personal treatment plan. So all of you should be able to look at this document titled My Personal Treatment Plan. And on the top, of course, is the client's name and their clinician. Now, this is an important part. If they were choosing medication, this would be filled out. If medication is not an option at this time, you simply just have to say, check the box, this is not on medication. This can be very confusing, medication. How many am I supposed to take? When am I supposed to start? When am I supposed to increase? When am I supposed to decrease? This is all really important, right? Because you don't want to just stop and start medications like that. So I don't want you to be in a position where you're doing anything outside of your role. If you need the provider to fill this out for you, I think I would invite you to do that, but just to make sure it's correct and that this is helpful to them so that they know exactly what they're supposed to do and when. With dates, it's difficult to find an easy way to map it out, but this tells you per medication, so there's enough room here for 3 medications. If there's more, you could just print another page, when they're supposed to start, how many days, from what dates to what dates. And then if that increases or decreases, then secondly, take this amount for so many days, and then from which date to what date. And then you can remind them, you can tell them that when they start medications, maybe they don't notice an effect right away. It might take a couple weeks. So not to be discouraged. Important thing to communicate is that if for whatever reason they're not happy, maybe they're experiencing side effects, it's important not to stop by themselves, that they should come back and talk to the provider about what the feelings that they're having. Okay, so that's medication section. This is a place for them to have it written down. They can fold this paper up or they can stick it in their wallet or whatever. But it's something for them to keep and refer to. Then the second section is about therapy. So maybe they are just starting therapy, maybe they already are in therapy, and maybe they're not in therapy at all and they're not going to try it. But it's a place for you to write down who they've been referred to, who maybe they're already seeing, and what's it for. Is it just for an assessment? Is it to start treatment? Whatever. This is a place to capture that. And then wellness. Maybe they've met with their provider and the provider says, I think we could just kind of wait and see. And maybe you just need to do some activities yourself, or, based on what you're telling me. If you don't want to do medication or therapy, your symptoms aren't so severe, maybe if you could incorporate some activities into your schedule, like some exercise or Tai Chi or something like that, we could give it a try and see how it goes. You could check the box for wellness. Are they being referred to the YMCA to see a counselor there, or whatever that might be? Maybe they just want to keep in touch. Maybe it's just a matter of a return visit, and we'll decide later. So you can check the box for keep in touch. It means we're not separating. It means we might decide to do something later. We're just going to keep in touch about this and see how things go. So this documents what happened at that visit with the provider. Next, we're going to talk about the personal wellness plan. Now, the wellness plan is really fun because this is where we get to, this is like your resource list. Okay, so it's not only keeping track of who's your medical doctor, what's their phone number, what's my name, what's my number, what's your therapist's name, what's their number, who's your person, who's your buddy, who's your confidant. Let's write that person's name down, and what's their phone number, because you might want to call on them when you're feeling down. Who's the friend that I can count on? Who's my pharmacist? If we want to change our medications. These are all really super handy names and numbers to have available to you all the time.